The broadcast is now starting. All attendees are in listen-only mode.
This is Danny Bobrow, President of AIM Dental Marketing, welcoming you to this installment of the Practice Perfection web-based education series. Today's presentation is entitled, How to Protect Your Practice and Your Reputation. The HIPAA privacy and security rules have once again upped the ante relating to the security and privacy of protected health information. As a healthcare provider, you are required to prove you have implemented administrative, technical, and physical safeguards within your practice. That's why it is no exercise in hyperbole to say that HIPAA noncompliance and data breach exposure may well be the #1 existential threat to your practice. While navigating HIPAA law can feel overwhelming, by the end of this session, you will know the top requirements and vulnerabilities surrounding HIPAA compliance and data breach protection. You'll also have 3 action items you can implement today to protect your practice and your reputation. #1 will be to better understand the current HIPAA landscape and requirements under HIPAA's omnibus rule. #2, you'll receive tips to quickly safeguard your practice and professional reputation. And #3, you will learn key steps to begin developing a culture of compliance for your practice. Jeff Browdy is a leader in HIPAA compliance and patient data protection. He is the CEO of PCI HIPAA, which specializes in helping medical and dental practices mitigate risks relating to HIPAA requirements and data protection quickly, easily, and affordably. Jeff has assembled a team of experts, including certified risk advisors, customer success specialists, and HIPAA lawyers. PCI HIPAA is endorsed by the American Association of Oral and Maxillofacial Surgeons, as well as the American Osteopathic Association, to help their members navigate HIPAA law and protect patient data. Since 2012, PCI HIPAA's Office Safe Compliance program has helped protect thousands of medical and dental practices nationwide. Before we get started, I want to remind you that Practice Perfection webcasts run for around 90 minutes. While attendees are in listen-only mode, we invite you at any time to submit your questions or comments using the question button on your screen. We will allow time following the presentation to answer your questions. However, if we do not have time to get to all your questions during the webcast, we will see that it is answered shortly thereafter. Attendance at this presentation entitles you to apply to receive 1.5 hours of continuing education credit. Shortly following the webcast, you will be emailed a brief survey with instructions on how to receive your CE. Participants are cautioned about the dangers of incorporating techniques and procedures into their practices if the course has not provided them with adequate clinical experience to allow them to perform it competently. And now it is my pleasure to welcome back to the Practice Perfection stage, Mr. Jeff Browdy. Hello, Jeff.
Thank you. Thank you. What an introduction. I'm going to apologize to all the attendees because my voice does not sound as professional and as nice as yours, but I'm going to do my best. So it's great to be back on the stage. Thank you for the invitation, and welcome everybody to Protecting Your Practice and Your Reputation. My name is Jeff Browdy. I'm CEO of PCI HIPAA. I'm going to touch base a little bit about who we are. I'm not going to go into our products and services so much, as this is a CE credit presentation, but just a little background. We've been around for a little over 6 years. We help service now over 2,000 medical and dental practices nationwide. And we're really, our passion and our strength is simplifying HIPAA, taking the guesswork out of HIPAA, and knowing that you are all very busy running successful practices, and you don't want to let regulation get in the way. But as we become more and more technical, this is important. And we've been endorsed by a number of different associations, as Danny had mentioned, the Oral Surgery Association, the Kentucky Dental Association, the Alabama Association, and we're also very honored that we were selected as one of the top 10 healthcare compliance solution providers by Health Tech Outlook. Today's agenda and my goal and my job today is to go through topics and really I feel like I've done a good job if you can walk away with, you know, 1, 2, or 3 things that you can take back to your practice and say, you know what, I heard about this. This is something I should focus on. It's important and it makes sense. I have a lot of information for you. I'm going to go through some of the risk considerations and HIPAA headlines, the requirements. I'm not going to go into a ton of detail, but give you kind of a high level in case you're not familiar with them. I'm going to spend most of my time on the common vulnerabilities. Myself and my team speak with hundreds and hundreds of practices every single month. So we kind of have a good idea of where the vulnerabilities are and the things that you should be allocating some time to address. I'm going to go into a deeper dive about business associates and ransomware attacks. And then I'm going to quickly go through 50 tips to protect your practice. And again, I'm going to go through them really fast, but my goal is for you to take away a few things that you can take back to your team. And then we're going to end with the HIPAA risk assessment requirement. And this is something sponsored by AIM, and think it's a really good idea so you can do your own self-assessment to see where you're at, and we'll have a Q&A session. We can have that along the way, or we can also have that at the end, whatever everyone feels most comfortable about.
And Jeff, just before you go on with that ambitious agenda in mind, I want to remind everybody that this webcast is being recorded. We will be sending you an archive. I don't want anyone to risk their livelihood by getting, permanent writer's cramp trying to jot down 50 tips to protect your practice.
Good point. Yeah, you don't have to take a lot of notes. Hopefully I'll keep you off of Facebook and your email because it'll be engaging enough, but we will send you a copy of the presentation right after.
You can test these days.
Great. Okay. So why should I care? Obviously, you're on the presentation because you care. HIPAA is the Health Insurance Portability and Accountability Act. It was enacted by President Clinton back in 1996. The purpose was to reduce costs and simplify the administrative processes. And I know a lot of you are shaking your heads, and I don't disagree. It's not simple, and I don't believe it's reduced anybody's cost. But the real gut of this, and I know HIPAA is a bad word, take HIPAA out of the equation and focus on improving the privacy and security of your patient information. I think that's something we could all rally around as a consumer and as a patient, that our information is really important and you have it, and keeping it private and secure is your responsibility. And that's what we're going to focus on. It's enforced by the Department of Health and Human Services, Office for Civil Rights, and I'll talk a little bit about that. There's a new sheriff in town, and we have to be considerate of that. So thinking through, what's my risk? Do I have a risk? Is HIPAA going to come out and get me? Well, it is the law, and there is a risk of being non-compliant. And think of it like filing your taxes. You have the responsibility to file your taxes every year. You're required to do that. You can't avoid it. Is an auditor going to show up at your practice tomorrow and audit your tax return or audit you for HIPAA compliance? Probably not. The odds are low, but it still can happen. And if it does happen and you're not following the law, your risks that you need to consider go up. Now, a greater risk, and what we see, is a risk of a data breach. So if you're not trying to prevent yourself and do the things to prevent those kind of breaches up front, then you definitely are at risk and you're increasing your risk. And what we see happening is if there's a patient complaint, it's very easy for a patient to go on the Health and Human Services website and file a complaint, and it happens all the time. Or if there's a data breach, it's a self-reporting tool. So if you have a data breach of over 500 patient records, it's mandatory that you file with the Health and Human Services, and then they will come out and audit you, and they will ask you, what safeguards did you have in place at the time of the audit? Or what safeguards did you have in place at the time of the complaint? And they can come back 6 months from when they receive it. So you really want to make sure that you're moving in the direction. There's no HIPAA certification, but there's things that you can do to document your compliance, mitigate your risks, and protect your financial being and your reputation. Now, we read the HIPAA headlines every day. I get feeds from Google. I subscribe to a bunch of different periodicals. We're on top of what's happening, and I'm going to share with you a few of those. So the Ponemon Institute, which does research around this, says criminal attacks are now the leading cause of data breaches in healthcare. And 1 out of 10 of you have had a data breach. 2 to 5 out of 10 of you, 4 out of 10 of you have experienced at least 2 to 5 breaches, and almost 59% of your business associates have had a breach, and we're going to dig into that. And those numbers, I mean, that could be as simple as you sending an email from, you were supposed to send it to John R. Smith and it went to John T. Smith. That's considered a data breach because you're sharing information with the wrong person. So these things do happen.
When you say that, nearly 60% of business associates have had a data breach, and you may delve into this deeper later, so I apologize, but that means somebody with whom you are exchanging this sensitive data has had a breach, and so by implication, those breaches can go viral, right?
Yeah, whoever you're sharing information with, and we're going to talk a lot about business associates because it's important and it's part of the omnibus rule, but if they breach your data, then basically, again, your reputation's at risk, right? Your customer doesn't care who breaches it. Your patient doesn't care. If you breach it, you breach it, and if your IT provider breaches it, it's still under your watch. Now, Yahoo came out and said the next data theft is your medical records, and they're posting this online. They're basically telling consumers and telling your patients that their medical records are at risk. And if you think about that for a second, why would that be the case? Why are your medical records a target? Well, unlike a yogurt shop, which I attend way too much in my neighborhood, and they do know my name probably, they don't have my social security number or my birth date. Maybe if they have a rewards program, they might have some of this, but you have on file social security numbers, birth dates, phone numbers, all of the information ready for someone to monetize on the black market. And here's an example, Danny, and everybody. This is a larger practice, 151,000 patient records, and it was obtained by user name and password getting stolen, and they went inside the database and they took the information. And we see this happening all the time. This is a HIPAA data breach. They have a self-report, and they have to go through a lot of steps that are required under the notification rule. And there's definitely risks around that. And this is an example of a dark web website. So as you can see, they're selling all kinds of counterfeit items, credit card numbers, digital products, and I circled down there because it's really interesting now. I'm seeing a lot more of this. They actually sell software as a service to commit identity theft and to commit malware attacks. So now someone who doesn't have a lot of technical skills, they can actually go out and buy software to attack your practice. Here's an example of the dark Overlord. This is their Twitter page. I follow this hacking group. I know I'm kind of a geek, but I do it because I want to know what my customers at risks are and what we can do to help mitigate them. But Doctors Feinstein and Rowe on 1245 Wilshire Boulevard, very close to my heart. This is right around the corner from where I live. I'm in LA. And he's boasting that he has 6,000 patient records, and one of his followers just says, just hack and give us all 800 credit scores. Well, he actually took possession from the practice by getting into the system. And remember I told you before, this is a self-reporting tool. Well, this is a snapshot from the Health and Human Services website and their portal that Feinstein and Rowe, they had to self-report, and they had 6,600 patient records stolen back in August of 2017. It was a hacking incident. And you could see that this is one snapshot in August. Every state, or a lot of the states, healthcare providers, health plans, different types of sizes, their hospitals, their medical providers, their dentists, they're all types. And they're hacking incidents, there's theft, there's loss. And again, I'm telling you, if it hasn't happened to you, that's great. But if you're not doing anything about it and not thinking about it, now's the time. And hopefully this presentation you'll go back and say, there are some things that we need to do to better protect the privacy and security of our patient information. Here's some of the headlines that I'm reading. This is really interesting. Healthcare IT news, $31,000 fine for not having a business associate agreement in place. And we're going to talk about that. The ADA announced audits. Are they knocking on every dentist door? No, but they are knocking, and they do get complaints, and they know that the industry is not compliant. Data for ransom, we're going to do a deep dive in. I told you about the notification rule. If you have a breach, you have to notify. You have to understand the rules. If you don't notify, Uber, for example, they had a breach last year. They didn't notify for a whole year. They actually paid a group $100,000 to cover it up. You will be fined like no other if you have a data breach and you don't report it and you don't notify your patients that happened and go through the proper steps. So there's things that you need to do. And this is our friend Roger Severino. He's the new director of the Health and Human Services Office for Civil Rights. And what's interesting here is I'm following his mindset, and he says that small providers are an integral part to our healthcare system, which you are. But he also says just because you're small doesn't mean we're not looking and that you are safe. If you are violating the law, you won't be. And he knows that these kinds of statements are statements to make sure that you understand that that's his carrot, that's his stick. That's how he wants to get action, because there's too much of it happening, like I showed you on the Health and Human Services website, and he needs to make sure that there's going to be movement. And he uses fines and other kinds of news to get people to act. And quite frankly, I believe that practices should be taking steps. The question is, how much time and resources do you spend on this? And that's what we'll talk about. That's what my job is, to try to help you balance that, because you need to treat patients. The fines are not insignificant. They're not. If you willfully neglect the law, just because you don't understand the law doesn't mean you're not willfully neglecting it. If you don't have these safeguards in place, if you're not showing that you're running a practice that cares about HIPAA and cares about compliance, you can get fined $10,000 per violation and up to $1.5 million. So it really is not insignificant. Now let's go through what's required. Okay, I mentioned the omnibus rule. It was enacted back in 2013, and basically some of the changes to HIPAA that are significant is, we mentioned your business associates are now required to be compliant just like you are, and many of them have no idea what to do or what they're supposed to do. The notification rule was enacted and changed to create a lot more notification requirements of what you need to do. You have to notify all your patients within a certain period of time. You actually have to do a press release. You have to notify the Health and Human Services, things like that. And then non-compliance fees and having a risk assessment were also part of that. Now, under the HIPAA security rule, which I'm going to spend a little bit more time with, there's 3 sets of safeguards that work together to create HIPAA compliance. And there's a lot of myths around what's required. And, if my data is in the cloud, that means I'm HIPAA compliant. But there's actually 3 different groups: administrative, technical, and physical. We're going to touch upon those right now. So starting with administrative, documenting your compliance is really important, because if you can't show documentation that you are doing the things that you need to do to be compliant, then if you ever did get audited, you couldn't show them that you're actually taking those steps. So some of the things to document your compliance are important is, 1, you need to assign a security officer. And I always say, if you don't give someone ownership, nothing will get done. So like in my house, if I say, let's clean the house, we need to clean the house this week, guess what? Nothing happens. But if I say, Julia, you're in charge of cleaning the backyard, and Reed, you're in charge of cleaning the front yard, then it gets done. So assigning that owner is key. Executing business associate agreements, really important. We're going to talk about that. Documenting workstation use and access. Who's using your devices? Who's accessing your patient information? Do you know their security levels? Do you know who's doing it and what's required? That's part of HIPAA. You need that. Creating a contingency plan. I'm going to talk about that. Conducting a risk assessment. We're going to talk about that. And your employees, they need to be trained, and they need to have updated policies and procedures so they can be trained. Now, technical safeguards is about securing and monitoring your technology. And you know, those are things like utilizing encryption, monitoring your employees' activity. We have many practices that have a login, admin@practice.com, and everyone is using the same login. Well, how do you know who's using what? How do you know who's going on Facebook? How do you know what's happening? Everyone should have a unique user identifier. You should be monitoring that activity. You should make a much bigger deal about passwords. That's very critical. Because like I just said, passwords are easily getting into the system, and you need to make sure that all of your patches and software and malware and firewalls are being updated timely. Your physical safeguards are around securing the access and restoring and destroying information safely. So obviously in your practice, you got to make sure if you're going to destroy something that no one can get a hold of it. And if you do have an emergency, or you do need to retrieve information, that you're retrieving the exact copy of that, and making sure that you're putting the proper facility controls in place so you know who's coming in and out of your building. Now, as you think about that, think about some of the misconceptions that you may have had prior to that little discussion. So these are the top misconceptions that we hear when we initially talk to practices. One, my IT firm has it covered. They have everything covered. I don't need to do anything else. Well, just by that discussion, most IT firms aren't training your employees, don't have updated policies and procedures, aren't executing business associate agreements. Maybe they've done a risk assessment for you. Maybe they're not. Maybe they're compliant, but most likely they're not compliant. And so there is a misconception that your IT firm handles it. And then when you take that to your practice management software, just because it's compliant does not mean the practice is compliant. There are other things that you need to do. HIPAA SHMIPA is my way of saying I don't have any risk. You do have risk. If there is any kind of data breach and you're not sure what to do and you don't follow the right directions, or if you have a complaint and you don't have these safeguards in place, there is risk, and it's not insignificant. And unfortunately, your general liability policy or your malpractice policy doesn't cover you, so you're kind of left exposed if you don't have additional protection. And your office manager, and if you're an office manager on the call, your office managers are superheroes, undoubtedly, but they're not Batman, Superman, Aquaman, and every other superhero. They're one. And it's hard for them to navigate HIPAA, all the laws, what you need to do, protect your information, and to help you run the practice. So they usually don't have it all covered. And you know, I can say one of the things that we do is we really work closely with office managers to make their lives a lot easier. Okay, Danny, how am I doing? I know I'm going fast. Are we doing okay? I'm going to jump into common vulnerabilities. Just wanted to get your feedback.
Hold on, I'm this one post on Facebook. I'll be right with you. You're doing fine. You're doing great. Keep it up.
Okay, so let's talk about those vulnerabilities. One vulnerability that we see is payment card industry compliance. You all accept credit cards for your practice. It's really important, obviously, but you need to have PCI certification, and PCI actually gives certification, and many practices don't have it. Here's what's required to be PCI compliant. So if you process credit cards in an internet device, you are required to do a quarterly IP scan of your IP address by a QSA, a qualified scanning assessor. That has to be done. You also need to perform an annual SAQ to make sure you attest to your environment and that it's secure, and then you'll get your certification. And you probably need to ask yourself a couple questions. Do I have that certificate? How much is my current credit card processor charging me for that? And am I being charged for non-compliance fees when I thought I was compliant? Now, a PCI violation is also considered a HIPAA violation. So if you're storing credit card data on Excel files, or you're using it for recurring billing and it's just easier, don't do that. It's a lot of risk. And if those numbers get lost, it's a HIPAA violation. In addition, you are now required to accept the credit card chip. So we're all getting that chip, and that lower, you see that credit card with that chip, we call it dipping the chip. If you're still swiping credit cards, you are now subject to chargebacks. So if you have a client who may be using a fraudulent card, that could happen, or they just decide that they're going to charge back the transaction, you will lose that chargeback if you swipe the card instead of dipping the card. And many practice management softwares have not converted their swipers to the ability to dip the chip. And so I felt like it was important just to bring that up, just to make sure that you understand the EMV mandate, which happened back in 2015. Now, email is another.
It's important. So you're saying that they need to have no reason. If you didn't dip the chip, then you're on the hook.
If you didn't dip the chip, you are going to lose the chargeback.
Yep, no matter what. Okay.
No matter what.
That reminds me of the good old reason code 53 for any mail order or online transactions that you don't have the card present. Really, just in case you don't know, folks, you can charge it back for any reason within 10 months, I think, unless the laws have changed.
Yeah, 6 months. 6 months.
6 months. Okay.
So email, another big vulnerability area. Many of you are still using Gmail or AOL or Yahoo Mail or another free service. They're free for a reason. They take that data actually and they use it for advertising, all that information. All I can say for email is I believe it's important that you have a email server and you have your own server that's generating your emails for you, that has scanning software on it, that scans your emails in and out. We're going to talk about ransomware, but email is the #1 cause of ransomware. That's how it gets into your system. And a lot of the email scanners protect you from that because they know when it's coming.
You're talking about protection from breaches. What about HIPAA compliance? I'm curious to know about how comprehensive and effective G Suite is, for instance.
Yeah, so HIPAA doesn't require, and they don't mandate the technology you use. So they could, you could use email, you could use whatever you want, you could use G Suite. They just say you need to protect that data, and you need to make sure your patient data is protected. Now, for example, let's say I'm using G Suite, and let's say I'm using Google Mail, right, as part of it. If I'm going to send you, and I'm a doctor, and I'm going to send you my patient records over Gmail and it's not encrypted, then you just have a lot more risk of what could happen with that data.
I guess my understanding was that G Suite differed from Gmail in that you pay for it, and it's supposedly, at least unless I'm mistaken, it's supposed to be quote HIPAA compliant.
Well, it might be, and that's fine. And if I don't use it, I don't use G Suite, so okay. I'm not an expert to it, and so I don't know. But if it is HIPAA compliant, then that's great. But all I'm saying is,
not the free Gmail, just so everybody knows, this is a different level of service.
Yeah, even if it is, it's still your responsibility of making sure when you're sending and receiving email that it's coming from the right people and you're sending it to the right people. And there definitely is vulnerabilities around email. And my suggestion would be, get on something that is secure, get on something that is going to have encryption when you share. You can share it without encryption if the patient approves to do that, but just be careful. Data breach protection. I touched upon this a little bit. So if you have a data breach, it's not covered under your general liability. It's not covered under your malpractice. This is a vulnerability with many practices. They don't have data breach coverage. They don't have cyber coverage. And if you have a data breach, you have to notify your patients. You have to do a forensic audit. It costs a lot of money to do that. It costs a lot of time, and you're going to want to get protected. If you get audited by HIPAA, if you get audited by PCI and you have a penalty, there's coverage for that. And if you have a cyber attack and you have to pay a ransom, which you shouldn't if you're doing the right things, but if you, God forbid, you have to, and more likely you're going to need time to recover your data, or you may have some loss of business profits. These could be covered in policies that aren't that difficult to get, and in the whole scope of things, they're relatively inexpensive. Our program covers it, but I won't get into that. But there's ways of having it, and my point here is just letting you know it's something you should definitely consider, because it's more likely that you will trigger a data breach or a cyber issue than you will a malpractice or a general liability issue. So we talked about business associates. Let me cover that. So a business associate, the general rule is that you as the covered entity needs assurances from your business associate that they're going to safeguard and protect your health information, and that must be in writing. So the obvious question is, who's a business associate? Well, it's a person or entity that performs certain functions that involve your protected health information, and they're doing it on your behalf, and they're providing services to you as the covered entity. So here's a little cheat sheet, and this will make it I think a lot clearer. So for example, if you're sharing information for a claims processor, a third-party administrator, an outside billing service, your practice management software provider or other software provider, could be your CPA firm. Now, not if they're just doing your taxes, because you're not sharing patient information with them. But if you're sharing information and patient information to collect with your CPA firm, then they're a business associate. They have to guard that information. Same with a legal service. If you're doing marketing or if it's your IT provider or any kind of consultant, if you're sharing that information for them to do their job, then you need a business associate agreement with them. Now, there's always exceptions to rules. So you do not need a business associate agreement with each other. So doctors don't need, dentists don't need business associate agreements with each other. You are covered under HIPAA. A lab. So if the lab you're using is to treat patients, you don't need a business associate agreement. You don't need them with government, Medicare, Medicaid, your payment processor, or your bank. And you don't need them with janitors, electricians, or landlords because, yes, they may be inside of your practice and your data may be exposed to them, but it's your responsibility to lock it up and make sure it's not sitting out so they can grab it. The reason why you don't need a business associate agreement with a janitor, electrician, or landlord is because your agreement with them does not require them to access your protected health information. If they're accessing it, they're breaking the law. Conduits such as the Postal Service, FedEx, and UPS, you do not need business associate agreements with them. And your employees, you do not need to execute business associate agreements with your employees. You have to train them. They have to understand the importance of it. They have to understand how to protect you, and they're your first line of defense, but you do not need business associate agreements with them. Now, the most important part of the agreement, now it has to define all the safeguards. It has to show what's permitted and not permitted. But the most important part is this indemnification clause. And what that means is that your business associate is going to indemnify you for any losses with data under their watch. And that makes sense. If you're working with an IT provider, if you're working with a marketing company or a CPA firm, if they have to sign and say, if I compromise your patient information, I will indemnify you for whatever losses you incur. And that's the most important part. And yes, it's an administrative nightmare to have these agreements signed and executed. We have ways of simplifying that. We got a lot of feedback from doctors to help with that, but it's worth it to go through it to get that indemnification because again, it won't take you that long to get it. But again, if they don't protect it, you want to make sure that you're indemnified. Okay, jumping to the HIPAA privacy rule, and we could do a whole webinar on HIPAA privacy, but I want to touch upon a few things that I see vulnerabilities inside of practices. And one is the notice of privacy practices. Most practices have these. If you don't, you need an updated version of it, and it explains the rights of your patients and what they can and can't do. You have to get an authorization that they reviewed it on their first visit. You have to place it on your website. You have to place it inside your office so it's visible. And if you ever make changes to it, you need to inform patients of those changes. They don't need to sign anything, but you need to inform them. I just got one from Twitter. You probably just got one from Facebook, or it's coming from Facebook. But you've seen those. But they're just notifying us. You don't have to get them signed. Your patients have rights. It's a great document. It explains what those rights are, and you need to train your employees on them. Have your employees read those notice of privacy practices. It's a really good training tool. And your patients also have they have to authorize your ability to share any of their information. That makes sense, right? Now, if you're treating a patient or you're trying to collect payment, you don't need authorization like from your bank or processor or another covered entity. You don't need the authorization to share that information if you're treating with another doctor. But if it's a family member, for example, and it's a family member that's if you're an adult, if they're a child, then you have the authorization. But if they're an adult child, you don't have the right. If you're treating an adult child and the parent comes in and asks for that information, you actually have to get the authorization from the adult child to do that. Unless there's some explicit consent and verbal consent, then that's okay. It doesn't have to be in writing, but they still have to give you the authorization. Also, patients do have the right to review their records, and you have to give them the opportunity to do that. So let me jump into contingency planning. This is the state that we see. I think we may need to update our disaster recovery plan. This one suggests we all run around in circles shouting, what do we do? What do we do? I get it. I mean, you don't have the time and you're not thinking about what may happen. And I put this in the presentation because, I live in LA and there were fires in LA this year. There were hurricanes on the East Coast. We had snowstorms. The weather patterns are changing, and you may not be able to get into your practice one day. And you got to think about, what am I going to do if that happens? It's important. And I saw this stat, and just to summarize this basically says that companies that aren't able to resume operations in 10 days after a disaster are not likely to survive. You don't want to fall in that category. You want to do some proactive planning to say, what if? What if this happens? What if I have a fire? What if I have a flood? What if I can't get in? Now, HIPAA actually requires this now for you to have this documentation. And they have 3 plans that you need to put together. It's a data backup plan, a disaster recovery plan, and an emergency mode operations plan. And HIPAA is interested in you securing and keeping private your patient information while you're in disaster recovery and while you're in an emergency mode. Now, the data backup plan basically says, how are you backing up your data? Who's backing up your data? Who's involved? Who's on the team? Where is it secured? Your disaster recovery plan is asking, if you have an emergency, if you can't get to your data, how are you going to restore it? And that, if you're going to take away 2 things from this section, it would be, you know what, maybe I should have a meeting and bring together some key members and start talking about, if something were to happen, where are we going to get a hold of each other? How are we going to call? Maybe it's a bridge that we set up. How are we going to get our data? Call your IT person. How can they restore it? If you had to go to Best Buy and buy a computer tomorrow, could they restore your data on it? How long would it take? Would you be able to use it? Because the longer you go without being in communication, the longer you may go without being able to treat a patient. And then in emergency mode operations, how are you operating during emergency? Meaning, after the dust settles, how are you contacting people? How are you paying employees? HIPAA doesn't require that, but these are things that you should be thinking of. How are you going to be able to treat patients? Where would you treat them? Do you have a backup plan? Can you share offices with somebody else? Maybe having some plans in place could help you if, God forbid, something happens. Hoping it never does. Not saying that you should go home tonight and drop everything and plan something, but if you haven't thought of it, this is just something to start to think about. Maybe spend an hour a month for the next 12 months. That's what we try to do to get progress on long-term initiatives. We spend an hour a month. We look back a year from now, we spent 12 hours, and we're way better off than we were a year ago. That's my point. Now, ransomware is a big vulnerability now, and this is one where if that were to happen to you, you want to be prepared. I'll talk a little bit about it. So this is a visual of, no one sees what's below the iceberg, right? But when you're talking about the web, we're all on top of it, on top of the waterline, and we're working on Yahoo and, I'm sorry, not Yahoo, they're out of business now, but we're on Amazon and Google and, all the sites that everyone shops on and is on. But under the dark web, like I showed you before, there is a whole world that is trying to gather social security numbers, licenses, credit card numbers, because they want to monetize it. So what happens during a ransomware attack, it's malicious software that will encrypt your files. It locks down the screen, and then they ask for a ransom, and it's typically through Bitcoin. And they use Bitcoin because it's anonymous. So when you pay somebody in Bitcoin, you can't trace it. You don't know who's getting it, and it is a currency. They create a sense of urgency to get you to act. And the way it spreads mostly is it's through email. And it could be a phishing email. It gets downloaded by one of your employees, and it spreads throughout your system, and then all of a sudden it'll lock down your system, and you can't get into it. And it establishes a pair of encryption keys, and you can't get in. And there's been an enormous amount of increases in ransomware attacks. We probably get a call twice a month about ransomware. This is what it looks like. So you walk in and you see this on your computer, and what do? What would you do at this point? Most of the time when you pay the ransom, you don't even get your files back. So one thing you definitely want to do is make sure that your data is offsite in the cloud, you have multiple sets, and that you know how to restore it. If you have that in place and you have that down with your IT provider, then you are much less likely. That doesn't mean you're not going to get hit, but you're much more likely to be able to continue operations than if you haven't thought about this.
Jeff, does it make sense if you do get hit with something like that, that you shut off your internet access immediately? Because my understanding is that if you don't, then you're doing regular backups that you can infect the latest backup.
Yeah, that's why I said you should have multiple days of backups, because if you don't do it in time, you may override one. And if you only have one set, you're right, you're overriding a good set with a bad set. So
but you should have that I forgot what you call it, not grandfather, but you have the sequential or
yeah. You have multiple sets. That's what you want. But yes, that's a very, very, very good point. So this is a sample of a phishing email. So this is what your employees get, and they think that it's a Dropbox email. It looks like a Dropbox email. It has their logo on it. It says view file. You click on it, and then it starts to spread. This is another example from PayPal, and this looks like something from PayPal. It really does, and it says, there's some, oh my God, we need your help. Call to action, update your information. And you click on it, and then it starts to spread. And so a real good probably takeaway here would be review some of these emails and review just how they look. They're getting more sophisticated. I'm reading about emails coming from CEOs of larger companies. They're very sophisticated on trying to fish to get into your system.
Spear phishing. Right, when they do a little online research to find someone who they think you would know or want to respond to, and they use that alias to fool you. So that's one thing. And yeah, if you read them closely, often you can tell, because these are often foreign, but not always. So there's a misspelling slightly, or also they ask you to click on something. Can you copy the link? I think I've done that and put it in the browser, and I just look at it. And often there's just something that's not quite right. If you scanned it fast, you'd think it's PayPal, but it actually says PayPal, or has something like that in there.
Yeah, there definitely is. But unfortunately, I guess my point is, and you're absolutely right. My point is,
it's not sufficient, and that's not my point either. And you've got a bunch of employees that are working at breakneck speed. You can't rely on that.
My point is, having a discussion on this is worth the time, because it starts to build, because they're your first line of defense, and that they start to build awareness, and you start to build some awareness, and that's what I'm suggesting, that build some awareness, because nothing's foolproof, and things happen, and they iterate on different kinds of attack mechanisms all the time. So you're never going to be foolproof. But we talk to practices that know nothing about this, and then the next day they know something and they have conversations. So at least having those conversations and building awareness will hopefully help a little bit. But like you said before, I think the big thing is making sure that your data is backed up, multiple sets, and that you know how to restore it, so you don't get caught in this ransomware maze. And you know, they're making a lot of money on it because they know the healthcare industry is just not up to speed with all of it, because it's hard. It's hard to run a practice and keep on top of all this. Okay, so I put together 50 tips. A lot of these I might have already mentioned, but just kind of, I think going through them again and reinforcing it. My intention is on all of this, on this whole presentation, isn't to overwhelm you at all. My intention is to give you as much information as I possibly can in, you know, an hour and 15 minutes or so, and therefore you can take it back. And hopefully there's some things that you're already covered, but there's other things that you know, hopefully will protect you even more. So I'm gonna walk you through these 50. I'll go pretty fast. You can stop me if you have questions. I don't know, is this a good time to stop for any questions, Danny? Have there been any, or you think anyone's still with us?
Yeah, there are, but you know, as I said, we like to hold the questions so we don't interfere with your continuity and run over time. So I would just ask you to continue, and we'll hold all the questions until after you're done.
Okay, good. All right. Assign that officer. The key here is someone who owns it, and someone who, even if you want to have them do a few things to start the ball rolling. I know this all seems overwhelming, but assigning that owner, first of all, it is the law. That R means it's required under HIPAA on the top. You have to show proof, and you have to have a document that shows what the responsibilities are. But just practically, having an owner is going to bring you a lot farther along. Perform and document a HIPAA risk assessment. Doing a self-assessment is key. And you also need to document that. We're going to talk about that in just a little bit, because AIM Dental Marketing has sponsored one for this webinar for you, and we'll show you how to take that. You also want to document your compliance progress. So as you start to check the boxes of the safeguards that you're implementing, you're going to want to make sure that when you did it, what the date was, what you did, who the person was, because in case you do get a complaint or you do have an audit, it'll make it a lot easier on you to be able to show what you're doing and that you're following the laws and policies and procedures. And on those policies and procedures, you need documented policies and procedures, and you need to have them up to date. Now, you could have the ADA book and it could sit on your shelf and it's not customized and employees aren't looking at that. That's probably not the best solution. It's great if you have it. I'm curious if anyone has it, if they use it or how they interact with it. We find that having something online and having users be able to go into is a much better solution than having just a book. Maintain and review acceptable use and sanction policies with the employees. So actually having a meeting and talking about what employees can and can't do with your devices, with your protected health information, and letting them know what your sanctions are. Again, these are required under HIPAA, but it's also a good job, because if you're never talking about it, then the employees will never talk about it or will never care about it. But as you talk to them, they'll start to help you enforce it. Train employees. Make sure that anyone that has access to protected health information, make sure that you're training them at least once a year, documenting that. You don't have to have somebody come into your practice and spend 3 or 4 days on HIPAA. It doesn't make a lot of sense to me, but what you do need is a process to help them understand it. And when they understand it, get some acknowledgments and show that they've been trained. Again, it doesn't have to be, it doesn't have to cost you a ton of money, or you don't have to spend a lot of time, but you have to show that you're doing it. We talked about the employee workstation access rights. You want to know who's accessing your data, and you want to know their levels of access. Provide those unique logins and don't share them. We talked about that. Don't have one username for everybody. It doesn't make a lot of sense. You can't tell who the perpetrator is. It's very hard to audit, and it's required to have them unique under HIPAA. Periodically review their reports. So your IT provider should be able to provide you with reports on who's going into your workstations and what they're on. I know all my employees, and I get a report every month. How many are on Facebook? How many are on Twitter? How many are on things they shouldn't be in? And we have conversations about that. especially when it's around their, it's the same workstation as your practice management software. Those things don't go well together. Personal websites and social media and practice management software. Document how PHI is accessed and secured during an emergency. Again, this is required. What are you going to do if something happens, if you have a ransomware attack, if there's a fire? Who's going to access it, and how are you going to keep that data secure? Execute those business associate agreements. Make sure that those indemnity clauses are in there so that you get indemnified in case something happens under their watch. As a reminder, you don't need a business associate agreement with employees or other healthcare providers. They're covered under HIPAA, and your employees are under you, and they need to be trained. Dispose of protected health information in an unreadable manner. If you're going to get rid of files, maybe you hire a shredding company. Make sure you get a business associate agreement with them, but make sure that it doesn't get in the wrong hands. Update your notice of privacy policy. That's important. Your patients have rights. You want to make sure those are all updated. Provide that notice of privacy policy on the first visit and put it on your website. That's important that you're notifying it and they know that you care about their privacy. And don't share any patient information without authorization. There's a lot happening now with social media and testimonials and Instagram photos and things like that. And you don't want to do something that you may think's okay, but someone else doesn't. And it could be a picture, it could be something else. Make sure that you get their authorization before you do that, and make sure your employees really understand that also, so they're not sharing information on their Facebook pages because they bring you into that liability. Make sure they understand. Remember, we talked about it's okay to share that information without consent as long as it's for treating the patient or for collecting the money that they owe you. I would implement the no gossip rule. We talk about this all the time. People love to talk, but people don't like to get overheard other people talking about them. And sometimes, for whatever reason, I read and see this happening in medical offices where they're talking about procedures, or someone thinks they're talking about them or something. And then the reason I bring this up, because this is what leads to a complaint. This is what leads to an audit. This is what leads to someone coming back to your practice and saying, what safeguards did you have in place when this patient complained? I think I already buried this one enough about patient photos on your website and social media without consent. Be careful with new employees. And I bring that up because, look, I trust everybody, and I think that's just who I am, but there are unfortunately some bad seeds, and we have had reports of employees stealing information and opening up credit lines at electronic stores and things like that. Just keep an eye out. You may even want to run background checks. It's not required under HIPAA that you run a background check, but it is required that you understand who you're hiring. So again, we've all made the good hires and we've all made the bad hires. Just something to think about. Train your employees on the dangers of downloads. I showed you those phishing emails. Sit them down, walk through that. Email and laptop computers are the #1 problems that we see that exposes practices to greater risk. I wouldn't allow workstations for personal use inside of a practice, especially if your practice management software is on it. I would have a separate station, allow employees to go to that on their breaks, and they can use it, but your own workstations is for business, not personal use. Make a bigger deal about passwords. Believe it or not, ASDFGHJKL semicolon is still the #1 password, and guess who knows that? Pretty much everybody. Or password 123, or Browdy 123, or Danny 123. I mean, they know that, and I'd make a much bigger deal about passwords and protection. Again, opening emails from someone you don't know, that should never happen. They should just be deleted. Here's a myth everyone talks about, we can't have check-in sheets anymore. Take out the check-in sheets. You're allowed to have check-in sheets. Just don't put information that you don't need on the check-in sheet. So it's okay to put someone's name on there, but you don't need to put someone's name and their procedure and their phone number and their social and their mother's maiden name and everything else. Just use the least amount of information you need to perform a task, and it's okay. It's also okay to call or text for appointment confirmation. Same thing. You know, we've had clients call up and they get paranoid. But I mean, just be practical. When you leave a message, or if you're going to text, again, use the least amount of information that you're going to use, so you don't get into an issue about a data breach potentially. Use a password or PIN for your mobile device. So you want to make sure that your PIN and your mobile device, because now everyone's using their mobile devices, that someone can't just get in there. Because if you lose it and you have patient information, it's a data breach and it's a reportable offense. So you want to make sure that your mobile devices are locked down, and then you can even enable wiping or disabling data on your mobile device. So if you happen to lose it, there's ways that you can have the settings where you could erase that data right away. And you want to make sure that that happens, because we have a lot of doctors, unfortunately, that have lost mobile devices. And if you have email information on there, if you have patient information on there, it's a data breach and you have to report it. Don't use public Wi-Fi. Use a virtual private network. Public Wi-Fi is very, very vulnerable. If you're sitting in Starbucks, if you're sitting in the hotel lobby, I just wouldn't be on my practice management software or my bank. I wouldn't be on my banking account. It doesn't, doing your online banking at Starbucks is probably not a good idea. Checking the news on Google and doing things like that is fine, but getting into any personal information, you're going to want to use a VPN or a private network. Delete all stored information before discarding or reusing a mobile device. So when you get rid of your iPhone, you need to delete that, especially as a doctor or dentist, in the right way. That is required. You can't have information out there. Don't store any patient information on a laptop. Laptops get stolen. They get left in cars. They get left everywhere. And if they're not encrypted, it's a data breach, and you have to report it. We had a practice lose 2 laptops. 4,500 patient names were on them. They weren't encrypted. There's a lot that we helped them with, but they had to go through a lot too, and it's just be very careful with laptops. Don't store any login information, because once they get in, then they have login information for everything. So often people will put their login information in their computers or in their contacts, and again, that opens the practice up for risk. Don't text PHI unless it's secure. So if patients ask you to text and they want you to text, it's okay as long as you get their written authorization, and that protects you. But if you just start texting and you're texting information and you lose your phone and it's not secure, again, that's a data breach. We talked about this, backing up your data off-site and using at least 256-bit encryption. So you want to make sure it's encrypted. You want to make sure it's off-site. It shouldn't be in your practice. And you want to make sure you have multiple sets of backup just in case you have a ransomware attack or you're on vacation or something happens. You want to have multiple sets. Workstation timeouts, 2 to 5 minutes. I've been in practices before where I walk in and the other patient's information is sitting on the screen. Now, are your patients going to do anything with it? Probably not. But I guarantee you what they're thinking is that my information is going to be up for somebody else. And that just opens you up for a complaint. So make sure they're timing out and make sure that you're not showing other information to other clients or other patients. We talked about Gmail, AOL, and Yahoo. I would get an Exchange server so you can control more about your email in and outs, and you can get some real software to scan your email in and out. Email is a big vulnerability. Use encrypted email when sending PHI. Make sure you're updating your firewalls and your malware with your IT provider. The big malware attack that happened last year was because many, many small businesses did not update their Microsoft 10 operating system, and they knew that, and it hit all of them that weren't updated. Lock up all your paper records. Sorry I even put that in, but that's one of the physical requirements, and you need to know who has access to your building. And making sure your copiers and fax machines do not store data. That's important because we've had clients who have copiers and they go back to the manufacturer, or fax machines they get rid of, and they have copier settings and storage settings in there. And people know that. And the first thing they'll do is print them all out when they get them. And then again, that's a data breach. Be careful with web-based services like calendars or appointment apps, like automatically making an appointment or posting. There's been a lot of practices that have accidentally posted not only the patient, calendar of them coming in, but all their information, their procedural information. Again, that's a data breach, and you'll be subject to audit and fines if that ever happens. Stop using thumb drives. Thumb drives can get lost. They're not encrypted. It's a bummer if you lose them. It's a data breach. We talked about updating your operating system and antivirus software. Make sure your web browser, especially if you're accepting credit cards, is using a secure socket layer. You'll see it in the upper corner on websites. It'll tell you if it's secure or not. It doesn't cost that much to do. Your IT provider can help you, but your website should have an SSL certificate. Obtain cyber or HIPAA data breach coverage. Make sure that you're protected. It's not covered under your general liability. This will give you that added sense of relief if something were to happen, a sense of security. It's important that you have that. And use that EMD device. Dip the chip when accepting credit cards. Get your certification so you can lower your fees, because you should not be paying for credit card equipment anymore. You should not be paying for PCI non-compliance fees. And as a healthcare provider, you should be paying under 2.5%. We see so many of our practices overpaying and paying all these extra fees. An easy way to check is to pull out your statement, take your total fees, divide it by your volume, and if it's over 2.5%, you are overpaying. You could save money, and you should be saving money. When in doubt, you can ask me. I'll give you my email address. We're a friend. We're friends of AIM Marketing. I will gladly help you with anything and any questions you have. The other great resource is the Health and Human Services website at www.hhs.gov. Before we wrap up or go into Q&A, I want to tell you that every practice is now required to have a self-assessment on file. It's required under the HIPAA security rule. You have to have it. It doesn't say how you have to do it, but it says you have to have it. And just doing a self-assessment is probably a good thing to do, to take inventory, to see where areas that you need to focus on. Here's an online link, secure, that you can go to and take your own assessment. You'll receive a risk score. Many of the practices that we do over 1,000 a month of risk assessments. Most of the scores are 70 or below, and there's things that need some help and need some guidance. It will all be in that risk assessment, and you'll be able to read through that. It shouldn't take you that long to do, and we will also, someone on my team will review that risk report with you and walk you through the vulnerabilities and give you some real good ideas on how to mitigate those. And my team will happily do that. If you have questions, you can email me. Our phone number's there. But I really believe this is a great exercise to walk away with. I think we have about 10 to 12 minutes, Danny, and I'd love to take some questions. And then I would love to wrap up with a little bit of a takeaway for you and the people on the call.
Sounds good, Jeff. Love to give you some questions. We've got plenty. And if you don't want to jot down that, well, that's not a bad link you got there. But just to remind everybody, following the webcast a couple of days afterwards, we'll be sending you a link to a recording of the webcast, as well as your webcast evaluation and CE quiz to take if you'd like to receive your hour-and-a-half of CE PACE-approved CE credit, and as well as a link to the assessment. So you can jot it down, you can do it now, but it's painless, it's free, and it really does open your eyes. So I strongly encourage you to take advantage of that. And we hosted Jeff about a year and a half ago or so, and I don't know if it's just that we only have so much time to cover things, but lots of new stuff here, which you promised, and I appreciate that, especially on the PCI side of things. And I don't know if that's new, or as I mentioned, you just may not have had time to get to it, but just how dynamic, is this? I mean, have the rules changed really significantly in the past year? Is it just a constant moving target, or are we ever going to reach any stability in this arena?
In PCI?
PCI in particular, yeah.
Yeah, I mean, PCI is, you know, it all started back when all the big retailers were getting hacked, and they still get hacked, right? We still read about it all the time. So
yeah, we do.
It's not changing, and you know, the pendulum swings, and then everyone's required to do things. We're just trying to help practices not have to spend too much time on it. The real key is not storing any credit card data, making sure your IP address is being scanned, and making sure you're having that SAQ done, that self-assessment question done once a year, and then getting your certificate. That's the most important part. But you know, it hasn't changed much, but we're seeing just a lot of practices overpaying for a lot of processing fees just because they just don't know.
Mm-hmm. Well, I guess one of the many benefits of securing a firm like yours is that this is what you do, and to the extent there are revisions or updates or more hoops to jump through, that's your job. So you kind of take that worry out of the mind of the dentist, so they can focus on what they love.
Yeah, exactly. And we have an online tool, so everything gets done online and it gets automated and changed and updated. So exactly, we're you know, we want to help the office manager and take the majority of the risk off the practice's hands, so that they can focus on treating patients. That's our passion, and that's what we do.
I know. All right, let's dive into some questions here. Do I need to execute a BAA, a business associate agreement, with an intern?
So an intern is treated just like an employee. So you don't need a business associate agreement with an intern, but you do need to train that intern if they're going to be exposed to PHI.
Okay. Next question, what is the best way to obtain data breach insurance?
So the best way is signing up for our program because it comes with it. But just, you know, everyone, you know, you could
tell us about it. What kind of insurance are you talking? What are the limits?
So our program comes with $250,000 of cyber coverage, full cyber coverage on the date of enrollment. So we found, you know, like I was talking about, that there's a lot of vulnerabilities around cyber, and so we wanted to include that. And so we have a master policy. Once someone signs up with us, they don't have to go through any other underwriting procedures or any other underwriting, because most practices have to get underwritten to actually get the coverage. And sometimes there's a lot of paperwork involved, and it's a pain. Other than us, though, you can go talk to probably any broker, and they will walk you through the paperwork, go through it, and you can go pay for it and get it. Anyone that takes the risk assessment, we will set up a call. We will walk them through our program, and we'll show them how our coverage works in conjunction with our compliance program.
What is the best way? Oh, you already covered that one. How can I tell if I am being charged PCI non-compliance fees?
So when you pull out your statement, which is like reading the IRS code sometimes, when you take your total fees and divide it by the volume, look down through your statement and look at each line item. And there's going to be a line item that says PCI fees, and there may be a line item that says non-PCI fees. And you know, we see practices paying as much as $20, $30, $40 a month for non-PCI fees because their processor hasn't helped them get compliant. And so what we do when we do the review is we also get a copy of the statement and do an analysis for our clients. So we tell them, look, you're paying over 2.5%. There's ways for you to pay a lot lower. And by the way, with our program, you no longer have to pay the PCI fees, and you definitely will never pay non-PCI fees ever again. So pull out your merchant statement, take a look at it, and you'll see it there.
Excellent. How do I receive HIPAA compliance certification?
So there is no HIPAA certification. It is an ongoing requirement to implement and execute the safeguards that we went over and to document your compliance. And so there will never be a certification. Anyone that promises you a certification is wrong. But it's important to, forget the HIPAA and forget the certification piece. I think we all agree that having a culture of keeping patient information private and secure is really what needs to be focused on.
How often do I need to train my staff on this stuff?
Minimum once a year. And if you have new employees coming in, they should be trained right when they come in. And if you have employees that aren't handling protected health information and then start to, meaning let's say you promote somebody and they're doing a different job, you should be training them right away and have documentation about that.
Very good. Well, there's another question about certification. We covered that. Could you delve a little bit more into how data breach coverage works?
Yeah, so what it does is if you have a data breach, we've seen practices that will, have to hire a lawyer to help with the notification requirement. And you have to notify all your patients. You have to do a press release. You have to conduct a forensic audit to define what happened. And that could have follow-up work. You have to report it to the Health and Human Services. That could be followed up by an audit. That could be followed up by a fine. And if you have that data breach coverage, whatever your costs are, they'll be covered. And if you don't have it, that just comes out of the pocket of the practice. It won't come out of your general liability or your malpractice policy. So
yeah,
it's
not covered by that. That's important for people to realize.
No, it's really not. It's not.
As you know.
And so if you have a cyber attack, if you have a data breach, and it doesn't matter if it's your fault or it's just something that it could be an error, it could be an employee error, it could be a hack, right? Like that, like that dark overlord. They came in and they hacked the system, and you could have done everything you can, or your IT person, but they just got in. Well, that's a data breach. Well, what are you going to do from there? There are things that you have to do, and there's costs that you're going to incur, and a good data breach policy will help you cover those costs.
All right. We are on the cloud for our dental software. Can you tell me exactly what I need to get from them to keep on hand at the office, stating that our patient files are encrypted on their end?
Every single software is different, so that's kind of a general question. What I would do is I would look at my agreement and my practice management agreement and see if it addresses encryption and see if it addresses what would happen with the data in their possession. But even if it is, it's still your responsibility to understand how to restore it and what would happen in case of an emergency. You can probably call them, and again, they're all different. So, and there's some new services, there's some old services. I think for you, the most important part would be to really understand what that means when they're backing it up, and what that means if they have to restore it, and understanding your agreement with them and what protections they're giving you in order to keep that secure. Now, HIPAA doesn't say you have to use encryption. I'm suggesting that you do, because, for example, we have point-to-point encryption, meaning once it leaves the server, it's encrypted, and it's encrypted in the cloud. That way, it just lowers the chance of it falling into the wrong hands. And if it ever does fall in the wrong hands, but you can prove that it's encrypted, you don't have any notification liability. That's the big thing that you want to avoid. You want to avoid the notification liability, and having encryption in place does that for you.
Well, is that because the presumption is that it can't be used, it can't be decrypted?
The presumption is that if you can prove that there is a low or no likelihood of them able to get access to it and do something bad with it, then you don't have to notify. Yeah. And if you can document that and show that, then you don't have you have a much less risk.
Are there different levels of encryption, effectiveness?
Yes. We suggest 256-bit encryption or higher.
Gotcha. Okay. Glad I asked. All right. Well, that's going to do it for the questions section. I just want to thank you again. That was important. Listen, it's not the most pleasant subject. I'm sure that part of everybody's brain is like, why do I have to deal with this? Life's hard enough. Can't I just practice dentistry and make payroll and plan for retirement? Ooh, that's a nice segue that I wasn't even planning, because it just so happens that that's going to be the topic of our next webcast. But I wanted to remind everybody, in a few days you will receive that email with instructions on how to receive your 1.5 hours of PACE approved credit. And yes, indeed, I do want to ask you all to please mark your calendars for our next webcast, which won't be until June. My travel schedule for May will not permit me to actually host a webcast in that month. But in June, we're going to be hosting Ted Schuman, whose webcast is entitled Planning to Prosper. Take these 10 simple steps today and sail into retirement. This special event will be on Thursday, June 28th at 6:30 p.m. Central Time, and will be presented by an equally special presenter, Mr. Ted Schuman, who is the president of Dental Business Services, also known as the DBS companies. Regardless of where you are along your career path, planning for retirement may well be the most important exercise you will perform. Properly planned and executed, it can mean the difference between happiness and fulfillment, and frustration and disappointment. We've all worked too hard not to reap the benefits of that work, which is why you don't want to miss this vital presentation by one of the masters of retirement planning for dentists. In the meantime, this is Danny Bobrow, wishing you a pleasant spring season and thanking you for your commitment to practice perfection. And thank you again, Jeff.
Thank you. Everyone have a good night.
Goodbye, everybody.